People who have had transplants and their caregivers speak about their experiences in this program. The patient seen demonstrating the transplant process is an actor. The following information is an educational aid only. It is not intended as medical advice for individual conditions or treatments. Your experience may differ from the experiences depicted in this program. Talk to your healthcare provider before following any medical regimen to see if it is safe and effective for you.
Seemed to be appointments back to back and tests that were not painful but tedious to go through. And throughout all of it, I tried to keep in my mind that they were doing the right thing and making sure that I really was a good candidate for it and that I would be safe and be a good risk going through the procedure of the transplant.
In this chapter, we'll explain the stage of a BMT called screening. This is when you and your healthcare team decide whether a transplant is appropriate for you. The screening process takes several days or more. It involves a number of examinations, tests, and conversations with healthcare providers. You'll receive a schedule of appointments in advance, but be prepared. It's very common for this schedule to change. As your healthcare team learns more about your condition, they may order additional tests.
Blood and marrow transplantation is a form of treatment for a person's particular disease. That may be the best treatment at that point in time for their disease, or there may be another treatment that is more appropriate. We look for the best treatment for the person's disease, not just whether or not a person can undergo a bone marrow transplantation.
Anyone who has a BMT will need the help of one or more caregivers. Typically, that's a family member or good friend. Caregivers provide important help and emotional support throughout the process. It's important for your caregiver to be with you during your screening. Both of you need to learn about the BMT process and what you can expect if the transplant happens. Also, you'll need someone to drive you home after tests that involve medications to help you relax or sleep.
The screening was important in that neither of us really knew what to expect, and it's not that they didn't tell us, but telling us and going through it are two different things. So it was important for him and for me to understand what was going on, that we were both together during that process.
Your healthcare team will examine your heart, lungs, kidneys, and more. They're looking for anything that might interfere with the success of a transplant or increase the risk. Some of the tests will reveal the current state of your disease. Some tests are as simple as a blood draw. Others make greater demands on you. During the transplant process, the body's ability to fight off germs and infection is greatly weakened. It's important that you have no infections present when the transplant process begins. It's even typical to check your teeth and gums for signs of infection. One of your appointments may be with a psychologist. He or she will evaluate your commitment to handling your responsibilities throughout the transplant process and your ability to cope. Talk with the psychologist openly and honestly. He or she may have some good suggestions to relieve feelings of stress at this time.
We pretty much focused on relaxation, how to manage one's life through this process. I hadn't had any major concerns that frightened me. But just one of the things she helped me to realize is that I'm pretty normal going through this with some apprehensions that are really normal.
You'll also meet with a social worker. She or he can talk with you about finding a place to live near the hospital, insurance coverage, or other financial concerns. If you proceed with a transplant, a tube called a catheter will be inserted into your chest or neck. The catheter goes into a large blood vein. It's used to deliver medicine, nutrition, blood transfusions, and the healthy blood stem cells. It's also used to draw blood for the frequent tests during the transplant process. This saves you many sticks with a needle. A catheter won't be inserted during screening, but a healthcare provider will decide on the best type of catheter for you. Screening may uncover problems that must be addressed before a transplant will be possible. If your physician feels a transplant is not appropriate for you, he or she will discuss other treatment options with you. There are things you can do to make the screening process go as smoothly as possible. First, go to all of your appointments on time. If they have to be rescheduled, it will only delay the process. Second, be prepared for your appointments. Follow any instructions, such as not to eat breakfast beforehand. Third, be flexible and patient. Additional tests may be necessary to give a full picture of your condition. The screening process has been designed with your best interests in mind. We appreciate the participation of you and your caregiver.